I'm sure you had great outcomes using the Maitland approach, but do you have any remarkable outcome using Maitland that you would like to tell us about?
Yes, I have one case, and I'll talk about her. I have several good results, and almost 26 years working with this concept. The others concept, of course, but that's my cornerstone of the assessment cornerstone. As I said earlier, this concept has its indication for neuromusculoskeletal problems. Okay. However, the application is much more than this. I always try to follow some Maitland's orientation, and you can see in some pages of this book. If you think about when a patient comes to us with any symptoms, and usually he comes in pain, that's the point. The first question we should ask: what's the cause of this pain? As you said just now. Because if you don't ask that question, you go treat the pain site, we're certainly not treating the cause of the problem, the patient problem. That's why the assessment, the subjective exam, is the most important item. We had 2 days before an interview that we talked here in Brazil about the subject exams. Only that. It was an hour and a half talking about this theme. Was very, very amazing. Many things to talk about, just one item, subject exam.
Yeah.
It's very important. It's very important to find out the patient problem. If you think about, we are detective, no? Could I say detective?
Yeah. Girl, you are investigating what's going on with the patient.
Yes.
You gotta have all the tools and everything that you can think and our experience to try to figure out what's going on. I think that's our goal.
So in this kind of exam, subjective exam, we find out the patient profile and we go through the assessment. And in this assessment, we have some questions, important questions to ask the patient. The first, of course, the main complaint. Why do you come here? What's your problem? How it happens, injury mechanism. It's very important. If it has a mechanical trauma. Clinical history is very important to ask all other things for the patient. Behavior of the symptoms in 24 hours period. What happened in the last 24 hours? How do you wake up? How to go to sleep? If you wake up at night with pain, that's an important question. There is a topic called special question and complementary exams. You see, complementary exams, when you check X-ray, RMI, etc., it's the last topic. It's not the first. Some colleagues, when a patient comes in his clinics, the first thing they see is the X-ray. What's the reason to see X-ray the first time? There's no reason, all right? So the special question part is a time to check if the patient has any red or yellow flags. Just to divide, to share the patient where he goes, to the mechanical direction or the organic or systemic or metabolic direction. Because if it goes to this kind of problems, certainly you have to send this patient to the medical investigation. Okay. We have. I'll talk about on a patient that I had. I think for me what's the most important patient that I treat with this concept. She was a female patient, a 15 years old patient. She comes to me with low back pain for 30 years. And she had been treated by several doctors and physiotherapists, but the pain never disappeared, never go away. During the assessment, I asked myself, how can a person stay 30 years with a low back pain? And I start the subjective evaluation. Some items, when we are in this part of the assessment, we usually mark with asterisk or any other symbol you wish to identify if something is very important not to forget. I remember that I marked she had a gynecological change. She had a myoma at 30 years old. Coincidence? 30 years old with low back pain and 30 years old with myoma. And we use a Mirena. Mirena is a kind of intrauterine device. Already 6 years old encapsulate, which would normally be removed the maximum 5 years of use. Or there's two important points that I found in this patient. Second, I usually ask the patient to bring to me blood tests. It's very important to see, to check how the chemical process is in those patients. She had abnormal blood tests, many red and white cells, and TSH problems. At the end of the investigation, I talked to her and advised her to find a new gynecologist. She accepted promptly. The consultation with the gynecologist specialized in fibroids was carried out, and he immediately suggested a surgery for remove the fibroids in Mirena. The post-op result was the 30 years old pain went away, and the patient said to me, the patient words, my pain disappeared as it had been taken away with magic. So you see, in this concept, in this context of the patient, a good evaluation could reach the cause of the patient problem. That's not necessarily be a musculoskeletal. It can be any other cause. In this patient, there was no education for treatment with the physical therapy techniques. That's I never taught her with any technique. I just talked to her, and I just stay in the subjective exam.
Yeah.
And you see, if it had been done a good medical evaluation, certainly this patient wouldn't have had the pain for 30 years. So there was an amazing case that I had of this patient.
I think that's a good example of how important it is to be trained to perform a good assessment and identify the flags, the red flags that are so so important to let us know if you're assessing, if you're facing a mechanical problem or not, because if it's not mechanical, we can treat them.
Yes,
so
of course.
So and I think so then you're able to tell the patient, I can help you. That's what you need to do, and then you refer the patient to the doctor, to go back to the doctor, or to do whatever you think that is appropriate in that case. And I think that's incredible, because it looks simple, but it's not, because this patient passed through so many doctors, so many healthcare professionals on her 30 years of pain. So I think having the ability to identify these patients that we cannot help and you cannot treat because they're not mechanical, that's right there is the importance of having a good assessment skills and being trained on an approach or in a system that allows you to screen the patient in the correct way and look for these specific signs and clues that we have on the subjective exam to allow us to just help this patient, right?
Yeah. The Maitland's resume what you said, clinical reasoning.
Yeah.
It's the amount of knowledge that you acquire along your life, studying, right? Taking courses, reading papers. That's it.
Yeah, that's how we develop our skills, and I think that's
right.
yeah, and that should be our goal: be able to identify what's going on with our patient and help them. We are there to help our patients to deal with their problems, and you have to be trained, and you have this ability to do that.
Yeah. I don't know, in the United States has the figure of a primary care?
Yeah, the primary care physician.
Yes. It's a physician, or could be a physical therapist. I think in Australia, a physical therapist could be a primary care. I don't know.
Yeah, the person with the first contact with the patient. So here it depends on the state. Each state has different rules and regulations. Some states, the patient can go straight to the physical therapist and be assessed and treat. Other states, they have like partial direct access that we call. The patients can go straight to the physical therapist, but at some point, in a specific number of visits or time, they have to have the doctor's referral to continue the treatment. And in some states, they don't have any direct access. You have to have the doctor's referral, so the patient needs to pass through the doctor first.
Okay. In Brazil, officially, you don't have this kind of primary care, but most patients looking for an old and a good physical therapist, because unfortunately you don't have the most of the medical physician diagnosis is not very good, because we just found diagnosis from images, X-ray, MRI, and the whole medical evaluation is not being done here.
So so I think assessing functionally the patient is the key, and that's why a lot of these approaches, they always say, like, don't worry too much about the image, the X-ray, the MRI. You have to see this patient moving, and first you have to have a good assessment and screen this patient. And then if you believe that's mechanical and it doesn't have any red flags, you have to move this patient and understand what's happening, and not putting
green lights. Okay, go through.
And if you see something on the MRI, for example, it doesn't mean that the patient, because he has some disc protrusion or some hernia on his back, it doesn't mean that he's going to have pain because of that, and vice versa. So we have a lot of studies showing that people that have problems, they don't have symptoms, and some people that have pain, the exam doesn't show anything. So it's not like it's not something that is certain. So I think most important is our physical exam, and so many doctors, clinicians, even physical therapists are not trained to do this functional exam. So I think that after the assessment, that's the other very important point, that we should be trained as physical therapists to be able to perform correctly. And again, being the main point, trying to understand what's going on with the patient through tests, right? So that's what we as physical therapists should do.
Right. Perfect.